The theme of my annual report as Director of Public Health for NHS Lanarkshire for 2009-10 is health inequalities. As I said in my previous report, tackling health inequalities in Lanarkshire is crucial and requires close working with our partners. The first chapter highlights how Lanarkshire is using the Equally Well Task Force report and the subsequent Equally Well implementation plan to tackle health inequalities. No one should underestimate the task that confronts us. The current economic problems have resulted in increased unemployment and job insecurity, which will adversely affect health and exacerbate health inequalities. The first chapter also describes work being undertaken in South Lanarkshire on environmental deprivation, which will inform planning of regeneration programmes. The chapter on the health of people in Lanarkshire shows the increase in population and the ageing of the population previously noted. Life expectancy continues to increase in Lanarkshire, although socio-economic differences persist, as well as differences between Lanarkshire and Scotland. More positively, coronary heart disease mortality has fallen more rapidly in Lanarkshire than Scotland, and there is evidence that the gap has also narrowed between people in the most and least deprived areas in Lanarkshire. In last year's annual report, I put a marker down on pandemic influenza A, H1N1, and the impact of the pandemic is now described in more detail. As it transpired, the pandemic was not as severe and the influenza virus not as virulent as we had planned for. Nonetheless, some high-risk groups such as pregnant women were affected much more, and the lessons from the pandemic will help us in the future. The promotion of positive sexual health is a key public health challenge for NHS Lanarkshire. A range of sexual health services have been integrated to better meet this challenge, helping us to increase our sexual health services across Lanarkshire over the past 2 years. Chlamydia, for example, infects a significant proportion of young people under 25, and we have set up a young persons clinic in each of our 10 localities. The section on cervical, breast and bowel cancer screening highlights some socio-economic differences in uptake. Pregnancy, newborn and preschool screening are also described, and all these show high uptakes. The oral health chapter emphasises the further development of child smile to reduce inequalities in dental health and access to dental services, and the importance of oral health in the workplace. As ever, I trust you will find the report of interest, and I welcome any comments or requests for further information.